Hello friends, today I'm going to talk about egg versus embryo freezing and what all do you need to know about this. So egg freezing is a process which involves retrieval of the eggs and then preserving them for future use. While in embryo freezing, the eggs are retrieved and they are fertilized with the sperms of either the parent or the donor, and then they are frozen to be used later on. So these days, a lot of females are delaying their parenthood, and so egg freezing is becoming a good option for them. So in the egg freezing, the eggs are retrieved and they are kept at sub-zero temperatures. They are preserved to be used later on, and it is an option for females, those who want to delay their marriage or they want to gain time to find a good partner. And it is also an option for the females, like those who are diagnosed with cancer or malignancy and they have to undergo chemotherapy. So before undergoing chemotherapy, all the doctors usually suggest the young females to preserve their eggs, because chemotherapy has an adverse effect on the gonads, and the quality of the eggs and the quantity of the eggs both go down with chemotherapy. So, how much do these both, the egg freezing and the embryo freezing, cost? So, typically, one cycle of egg freezing costs between 1.5 to 2 lakhs, and this includes the medications and the process of the procedure of egg retrieval. And the cost for the annual charges for egg freezing range anywhere between 20 to 30,000. While in embryo freezing, there is an extra step involved, because the eggs are taken out and they are, injected with the sperms, and then these embryos are cultured and then they are, frozen either on the day 3 or the day 5. So one cycle of this embryo freezing usually costs between 2 to 2.5 lakhs. And then now, what are the success rates? Are they equal in embryo freezing and egg freezing? So, what we have seen is that the embryo freezing gives better success rate because the embryos are more stable, and then we can see the development of the embryos before transferring them into the uterus. On the other hand, the egg freezing, if done by vitrification method, gives better results, but still the recovery is not as much as in embryo freezing. In embryo freezing, the recovery of the embryos is almost 90 to 100%, while in the egg freezing, the recovery is just 60 to 70%. And the age of the female and the quality of the eggs, that also contributes in the final outcome of these eggs which are frozen. So then there are certain myths involved with these procedures, with the egg freezing and embryo freezing. People think that once they've frozen their eggs or they have frozen their embryos, the guarantee of this guarantees a pregnancy. While this is not true, egg freezing and embryo freezing increase the chance of pregnancy in the later years, but it is not a promise. Then the second most common thing which people believe is that the frozen embryos are not as good as the fresh embryos, but that's wrong. The frozen embryos are as viable as the fresh embryos. And recently there was a baby born out of an embryo which was frozen for almost 30 years. And ideally the eggs, they should be frozen before the age of 30, because that time before 35 the quality of the eggs and the quantity of the eggs in a female are more, and we can retrieve more eggs, and we can freeze more eggs, and the chances of a pregnancy later on, they improve with these. This ideally, they should be frozen between the before the age of 35 for non-medical reasons, but they can be frozen at any time after puberty for some medical reasons also. Thank you.